Hello, my name is Melanie and this is Roger, and we're here to present and teach safe sleep here at Banner Children's. We want to promote the overall safety and well-being of your infant and children, and so here is our little environment.
We see somewhere around 75 or so cases of sudden unexpected infant death per year in Arizona. I've been sitting on infant and child mortality review teams where all of the infant and child deaths are reviewed in the county for many, many years. And we almost always will have at least one unexplained infant death, usually from unsafe sleeping environments. An unsafe sleeping environment is very much like this crib. One of the things that we have here is just too much stuff. Babies will get under these blankets and will begin to rebreathe the carbon dioxide that they're breathing out. This kills their drive to breathe, and they can just stop. The other thing that can happen is the child can simply overheat. So you're best keeping your child on their back in the crib, in a onesie or maybe some footy pajamas, with a receiving blanket. That's basically all they need. Make sure that they have a nice, firm crib mattress to sleep on.
And also no stuffed animals, no bumper pads. We don't do that anymore. They can roll and suffocate in between the bumper pad, and again get too warm, as Roger was saying, and also suffocate within the stuffed animals. Beautiful to look at, keep them on the shelf, please. And also, as far as the firm mattress, you can always test that. You can make sure all of your cribs, this is a pack and play. Obviously there's the cribs, the bassinet. You would want to put the feet at the end here, and if you do wrap, especially when they're really small and not rolling over, you can use a very thin, these are muslin blankets, to swaddle, but once they can roll over, we advise no more blanket, just like you were saying is the onesie, and they don't need anything else. If you do use a blanket and their feet are down here, you can tuck it around here at the chest, but not above. Also, we don't advise sleeping overnight in car seats or bouncy seats, swings. Again, they could slide down. There's risk for suffocation.
So the major problems that we see, in sleep environments are unsafe sleep location. Baby is sleeping with a lot of extra blankets, a lot of fluffy stuff, and a pillow, or maybe several pillows. Another terrible unsafe sleeping environment is in an adult bed. The adult beds are not made to sleep infants. They are dangerous, and the danger gets even worse with an adult in the bed. Frequently, the babies will get pushed down under the covers and have the same problem that they do in the unsafe crib. They can also be rolled over on and suffocated in the middle of the night.
And as he was saying, again, co-sleeping, especially if you're feeding your baby, especially moms that are breastfeeding, obviously it's comfortable. We advise to either be sitting up, or if you're bottle feeding, especially at night, to walk around with the baby so that you don't have a risk of falling asleep and falling off of a chair. And also, again, that if you're in the bed feeding or on a couch, the child can slip, and we've had cases like that of suffocation in an arm of a parent.
Yeah, we also see a lot of really tired moms and parents. This new baby that you bring home is going to wake up about every 2 hours around the clock to eat. And the reason for that is they have a very small stomach and they have a really big caloric need. So they have to eat small meals really frequently. Babies usually will not sleep through the night until somewhere around 2 months or over, and they may go a little bit further than that. One of the things that we see therefore, is a really fatigued parent. Having a baby is an extremely fatiguing experience. I've never done it myself, seen it happen a lot. Does not look like anything I want to do, but it does take a huge amount of energy, and it takes a huge amount of energy to take care of a newborn baby. So be aware of the fact that you could pick the baby up, put the baby in bed with you, not intend to, but just go back to sleep and have a really bad outcome.
Yes, right. Some parents do that. We've seen babies fall, parent falls asleep, the baby falls out of the parent's bed onto the floor and end up with a skull fracture, abusive head trauma. And we love babies, but we'd rather not see them in the trauma center. I wanted to also touch on feeding. With the feeding, we advise no propping of bottles, especially when you're putting them in the car seat or what have you. They can choke, and there's other risk factors involved with that. Also, we advise offering pacifiers to soothe them at night when they're sleeping.
Another terrible sleep environment is going to sleep with the baby in a recliner. The youngsters often fall out of the parent's arms and hit the floor, have a skull fracture, and maybe some bleeding in the head. Probably the worst place to sleep is on a sofa. Basically, don't put a baby at any age on a sofa. We see kids every week that take falls from the sofa and get head injury, usually a skull fracture, sometimes some bleeding into and around the brain. You also will have the parents sometimes lay on the outside of the sofa with the baby next to the back. The baby can wiggle down into between the seat pads, and also parents will roll over and suffocate the baby against the back of the sofa.
In Arizona in 2019, there were 75 cases of sudden unexpected infant deaths. 99% are preventable. We want to promote your child and your family for a healthy, long life. And so just taking these measures that we've discussed will promote that and lead to that, promoting safety. And also, I forgot to mention not to smoke around your child in the presence of a baby. That also increases their risk.
So we want you to enjoy this new baby as much as you possibly can. Remember safe sleeping at all times. And we thank you very much.
Thank you, and have a great rest of your day.